Okay, so I've imported a patient for you all to have a go at planning at. So we're all going to have a look at the same patient, but I've copied the patient enough times so we all get our own patient. So I'm going to give you a number each, and I need you to remember that number because that's the patient that you're going to work on for the 2 practical sessions. So to open our patient, we can either hit the icon there, or we can go File and Open, and your patient will be PPT 1 to 18. Okay, so I'm going to be PPT 1, so I can search there, and it comes up in that box there. If I was to just type PPT, then it would come up with all the patients labelled PPT. Click OK, and one thing you need to get used to with Eclipse is these file trees. So it uses file trees a lot, like older versions of Windows really. So this is the patient here, and we can have expand and minimise these trees. And the screen can get quite busy actually with lots of things open, so as a general rule I tend to just display the things that I want to see. But let's have a see what they are. So C1, C relates to a course, so that's course 1 of radiotherapy, and you can see this patient has 2 plans on them. They've had 2 sets of diagnostic images. A structure set is something that we've contoured, a set of contours. And then DICOM view is some things that have been exported. So yours may look slightly differently to this, but the thing that we're interested in is starting from a clean sheet in terms of a plan. So we don't want to open any plans that this patient's had before. We're going to click on rectum, and we can see that the patient's had a bladder contoured, a body contoured, a G, a C and a PTV. So we're going to click OK there. And we can see that this is now our patient open. So I'm just going to move that across slightly so that we can make this screen a little bit bigger. So as I said before, a number of tools across here. Down the left hand side is everything to do with this patient, and again we can maximise and minimise those. So we can see here CT1 is the image set that we're on. We can see that we've got this structure set called rectum, and within the structure set we've got some structures, and then I've also placed some reference marks in the patient as well. So I'm not really interested in those at the moment, so I'm just going to minimise those. We can see here we can view the patient in different planes, and actually you can, there's a number of different ways that you can set the patient view. So have a click on those and play with the different views if you like. I tend to stick to that one there, the orthogonal views. And one thing that makes life easier excuse me, is if you click on this workspace bar, and that allows us to flick between the different modules if we need to do that. So we can maximise and minimise the different views using these tabs here. And if we click on the patient, left click, we can scroll up and down the patient, and as you can see this line here as I scroll up and down represents where we are in the patient, and we can scroll ant to post in the patient, and in the sagittal view we can scroll left to right, and again we can maximise those and minimise those as we want. We can use this zoom function, so we click on zoom, we can draw a box around an area and zoom in on it and then zoom out. We can pick our hand up and we can move the patient around, and we can change the window level on the patient as well. So again, have a play with all of these and see what they all do. So for the moment I'm concerned with this axial view, so I'm just going to zoom out, and we can see here that we've got a number of contours displayed and some points on here, which I'm not too concerned about these points at the moment, so I'm just going to tick that reference point display, and that turns those off. And if we open this up again now, we can see that yellow is our bladder, so we can see that contoured. We can see red is the gross tumour, green is the CTV, the clinical target volume, and P is the planning target volume. And again we can tick to turn these on and off if we want to see them or not. And they're similarly visible in all the different planes as well. We've got this 3D view here as well, which isn't hugely useful to us at the moment, but we can spin this round if we want. And actually, when you do some contouring, it can be useful sometimes to kind of get a feel for what's going on inside the patient. One thing that you will come across doing a lot when you're using Eclipse is you'll try and click on something and you'll think it doesn't want to work, and the reason is because you've in order for lots of functions you need to have this select arrow turned on to be able to pick things up. So if it's turned off when you click, then it doesn't allow you to pick things up and rotate them. So if you're trying to do something and it's not doing it, it's probably because you've not selected this arrow here. So the other thing I'm going to do is, just to make the screen less busy, I'm going to turn off that window level function again. So we don't have a plan on the patient at the moment, so there's no information down here. So as I said, this is how, if you worked in a planning department or pre-treatment, then this is how the patient would look when it came through from the clinician markup. So in the next video we'll have a look about how we put some beams on this patient.